and fat reduction necessary in the submental lateral neck, mandibula, and jowl to the nasolabial fold. We want to exclude patients, obviously, who are not medical candidates, but also those because we're using radiofrequency with external pacemaker, implantable defibrillator, and other type of equipment without cardiologists being consulted. We want to assess the patient on laxity, facial volume, comorbidity, and take pictures. We want to prep the area. Generally with chlorhexidine is probably ideal for this. And then we use tumescent anesthesia, usually in the range of about 40 to about 85 or 90 cc's, depending upon the area that we want to do. We map the marginal mandibular nerve with a nerve stimulator. The procedure is very, very straightforward and fairly simple. We divide the neck into 3 zones, paramedial, right, and lateral neck. Insert the electrode fully, avoid contact with the hub. Wait until the temperature reaches the temperature we want. Subsurface temperature is set between 55 and 65, and we want the epidermal temperature never to exceed 46 degrees. We want to monitor that external temperature, and we want to slowly withdraw the electrode at about 0.5 to 1 centimeters per second, and just keep this consistent. Keep the actual temperature within 3 to 5 degrees of the set temperature, and do a linear fanning technique. Clinical endpoint should be the skin about 42 to 46 degrees over the entire area. The entire area should have a uniform color, and you can see this clearly in the monitor that comes with the device. The actual temperature and set temperature should remain about 3 degrees apart. To avoid complications, you want to avoid tenting the skin, catching the dermis with the cannula, and hitting the distal skin with the cannula, and you want to monitor and cool with saline if the temperature goes up above 46 degrees. To prevent the marginal nerve injuries, we tell people to start out doing the submental area as you would with deoxycholate. It's very safe. You're just avoiding the marginal mandibular. But you want to map the nerve, especially if you're getting close to it, in the jowl areas, and fuse around and over the nerve to create a physical distance. Consider lowering temperatures in patients with thinner skin, and obviously stay away from the mapped nerve. So just a little quick thing, for a submental treatment, this is incredibly simple. We inject a little anesthesia in the area. We mark the area that we want to see here. We set the temperature here. And then, as I said, very simply, what we're doing is slow and very methodical treatment. The submental area I can do in about 15 minutes. The patient comes in, and this is showing the monitoring. Patient comes in, they go out, and this is a very, very simple treatment. The nice thing about this is there's also a companion non-invasive thermo-smooth device, a reusable non-invasive treatment tip like this. This is ideal to topically tighten areas. It's been shown to change within the histology. Here are just some examples. This is one. And here's another one. This is Barry DiBernardo. You can see some very nice, we do this a lot around the eyes. There's some very, very interesting data that shows it helps dry eyes as well. So this is, and it's a totally painless treatment with no downtime whatsoever. So in conclusion, our patients are looking for that magical, safe, effective, minimally invasive procedure, and I think injectable RF for these indications is ideal for fat reduction and skin tightening. It can be augmented by the topical, and the consensus guidelines give us some methods for optimal results. So, oh, and by the way, you're all invited to South Beach Symposium in March in the South Beach. It's a wonderful meeting. Thank you so much.